So I'm going to walk you guys through how to put the Lucas on for your patients. So like when you have a code that gets called here, the first person that finds them and finds that they're unresponsive should yell for help. Have somebody else call your 203722 number and also call 911 to make sure that the squad's rolling. I know that there was a problem with that, I think, on the one person that you guys had pass out here, and then they call the squad right away. So make sure that that's getting done. They will then, the person that found them will start CPR on them until the crash cart and the Lucas and so forth arrives. At that time then, you're gonna open up this case. The backboard that you're gonna be putting behind the person is located in the top lid. That's right here. So you and another person will lift the patient up, slide this board underneath them. The person that was doing chest compressions will manually keep doing chest compressions then while the rest of this gets set up. So this is gonna pop out of the case here. And if you'll look, there's a clamshell grip on each side here. If these happen to be closed like this one currently is right now, where it's not gonna lock into these black rods on this side, there's a little yellow lever over here that if you pull this, it opens them back up. We've had it happen before too in the hospital where we're going to put this on a patient and it gets kind of tied up in one of the bed sheets or something and accidentally closes. So if it ever does that, just pop it back open. This will fit over most people. The only time that we've had problems with it, some morbidly obese people are a little bit bigger. What we do and what the rep had recommended for us is if that's the case, if you take their arms and actually put them above their head, sometimes it'll like kind of narrow them out somewhat that you can still get it on. There are some of those 400 pounders though, this just isn't gonna fit on there. You're gonna have to do manual compressions through the whole thing. If you can get this on, you're better off because not only does this do the compressions for you, it makes sure that your rate's right, it makes sure that you're getting that 2-inch depth. And then the suction cup on here actually suctions to the chest and pulls the chest up during the diastolic portion. So you actually get more blood back into the heart for the next compression. So you're gonna get better perfusion. Since we started using this, we do have several people that will wake up in the middle of compressions, even though they're still asystole or in defib. So we've had to do some fentanyl or Versed once in a while on them, like because they're awake, they'll start yelling to stop compressions, you pause it, and then they go back out again. They don't have a pulse, it's all from this. So be aware that can happen. So what you're gonna wanna do then, this backboard, you're gonna wanna get the top of it like as tight up in their armpits as you can because you want the bottom of the suction cup above that xiphoid process on here. So you're gonna like wiggle this up as far as you can. You're gonna take this then, snap both sides in. So like I said, these grips are gonna go into those black bars on each side and you'll hear the fin to click when they lock in. So that left side locked in there. This one locks in here. Get this up into place as far up on him as you possibly can, like I said. So then what you're gonna do is you're gonna push this green button on the top. This here is the power button. You're gonna turn this on. And you're gonna start out in the 1 position. So it shows right on there that at this point, this is where you're gonna push this down so that it's touching the chest. So that's giving this thing the mark as far as this is where we're gonna start our compressions, and it's gonna do compressions 2 inches below that. We have had 1 or 2 cases. This is not meant to be used on pediatrics at all. That we've had like a little frail grandma that weighs like 70 pounds that you go to put this on and you slide that down, it'll start alarming at you if it's too low because it thinks you're trying to do it on like a pediatric patient. You won't be able to use it if it starts alarming from that because it just doesn't have enough room left to be able to go 2 inches past that. So if it starts alarming you about that, we're gonna have to abort this and just do manual compressions. But like I said, 98% probably of people this works on. So in number 1, like I said, you push this down until it's touching the chest. Then you hit the number 2 button here, which shows that pause button on it. That locks it into place, so it's set to where you want it to be. And then number 3 here gives you 2 options then. So if they're not intubated, you're gonna do the one that says 30 to 2. Otherwise, if you have them intubated already, you push the other button and it's just gonna do continuous compressions the whole time. So considering this person is not intubated right now, we'll hit the 30 to 2 button. This thing is going to start, and it just keeps going like this. Then it will give you an alarm like right before that 30 compressions to let you know when to do your breath. And that's really honestly about it as far as that's concerned. Then. So, like I said, nice thing about this, once you actually get this locked into place, things calm down. Usually in the code, you've got people lined up waiting to change up the compressors. Everybody's starting to huff and puff because they're getting out of breath and so forth. Once this is going, this whole portion of the circulation is taken care of. You don't have to worry about it. You can start worrying about your meds, making sure that you're going through your H's and C's, trying to figure out what actually causes this guy to go down. So, if you do see signs of life, what you would do then is you would just pause it here, and that'll stop it for you so that you can do your pulse check at that time. If that's not, if you don't see any signs of life, I would recommend you just let this thing keep going. So the only time that you may have to pause it otherwise is when you go to do your defibrillation. There are a lot of times that if you've got the pads or the patches in the right spot, you'll be able to see what rhythm they're in, even with this thing going. But if you need to stop for a second just to see if it's a shockable rhythm, you can pause it quick, like look at a quick screen as far as like what the rhythm is. If the shockable, either way, if the shockable or unshockable, turn this thing back on right away so it's doing the compressions the whole time. You know, it's not going to affect us at all, like when you shock the person. So this thing can be doing it the whole time it's charging and when you shock and then afterward. You're really not supposed to pause it after the shock, even if you get an organized rhythm for the next 2 minutes anyway. So I would just like let that go then, because a lot of times, even if you get an organized rhythm back after you shock them, it's still not perfusing yet. So you're supposed to be doing compressions until that next 2 minute cycle, or if you start seeing signs of life like we had talked about before. When you're all done then, you're just gonna take this thing to pop it off. Well, I guess one thing for you guys, EMS may ask to take this. I'm not 100% sure. A lot of them have it on their squads. They'll bring it back right away afterward. It's just a matter of not having to change the whole thing out. So I'm not sure what they're going to do with that, but they would bring it right back if that's what they decide to do. So they may ask for it. It's okay if they do. When you're done then, you're going to hit the button, the pause button, go back to number 1 where you're able to move it. You're going to take this thing off the chest. You're going to pull the 2 levers here to take it off. This suction cup here is disposable. You've got 2 more in your bag here to be able to change out with. So when you're done then, you're gonna wanna take this old one off and put a new one on. Always have this thing loaded before you start. Because of the fact that this thing actually pulls the chest down, it locks in here kind of tight. It's kind of fumbly to be able to get it on to begin with. So I recommend that you actually have one on here like all the time, so you're not doing that like when your patient's actually coding, trying to get this thing back on. And then we usually keep an extra in the bag just in case one's missing. One other thing that I did forget to talk about, and I don't think this is going to be an issue for you guys at all. But so you're going to change this out first and get that done. Wipe the whole thing down. Make sure to get your backboard back. We had it happen in the ED one time that a patient expired and they let the family in. They left the backboard behind them. Funeral home came, took the patient in the backboard. We never got the backboard back. Those backboards cost $1,000 to replace. So make sure you get your backboard back. The other thing you're going to want to do when you're cleaning this, then, these batteries, I'll shut this off. These batteries pop out. You guys do have a second battery and a charging unit wherever you're keeping this. They do pull rather hard to get out initially, but then you would take this old battery out, put the new one in, put this one in the charger and replace it. They don't want this battery in here. Like when you just have this thing sitting in the case, they do not recommend that you have it on the charger all the time that plugs into this unit. But you do have a charging unit for the Lucas itself as well, along with that other charger for the battery. What this is used for is if you had like a prolonged code, which I don't think you guys are ever going to have here, but if you have one that lasts like 45 minutes to an hour, this thing will start alarming that the battery is getting low. If that ever happens, what you do then is you take this charger and it hooks up right into the port there, and then you can plug it into the wall and it'll run off a wall power. If you don't have the second battery handy. If you change out the battery, you're gonna have to go through the steps of hitting the 1, 2, 3 again when you're done with it otherwise. So we have had to do that before. This will be kept in your box as well. I think that's about it on the Lucas. Do you guys have any questions at all on that?
No.
No? Okay.
All right. The amazing Jerry Jones, everyone. Woo!